Hello, and welcome to the Conduit Street Podcast. I'm Jack Wilson, Queen Anne's County Commissioner, representing District 1. This podcast is your connection to Maryland policy and politics, covering the issues that shape our communities and the decisions that impact everyday lives. Let's dive in.
Welcome to the Conduit Street Podcast. Glad to have you back. This is Michael Sanderson from the Maryland Association of Counties, here to host this episode. With me is my staff colleague, Karrington Anderson. Karrington, welcome.
Thank you. Glad to be here.
Well, glad to have you aboard. We're going to talk about a topic that is in your wheelhouse. Karrington, on behalf of MACO, covers a policy portfolio that deals with sort of our public sector employees who work and serve in county government, and also works on health policy. And both of those are affected by the stuff we want to get into in this episode. For our employees and their families, there's always been a challenge for funding and providing healthcare and support, access issues to physicians, and always challenges with rising healthcare costs. We want to talk about an alternative option that Maryland counties are embracing, picking up on, and moving forward with. I think this is a pretty good topic for us to get into. Karrington, you've been working on this a little bit. You got a few thoughts?
Yes, definitely. Well, like a lot of our viewers and listeners know, county government is a very people-intensive enterprise. So we really value our employees and we want to take really good care of them. And I think our guests will come in and add a lot on that. We have Beverly Churchill. I've worked with her a lot in the HR sphere, and she's the director of benefits for Queen Anne's County. And then we also have Stuart Sutley with Bolton Health. Bolton does a lot of work in the public sector, and a lot of that connects back to employee benefits, like you said. And we're going to talk about advanced primary care today. Beverly was really instrumental in partnering with Queen Anne's Board of Education to put the first public sector health center in Maryland. So really glad to have them joining us today.
So welcome, Beverly and Stuart. Glad to have you on the podcast.
Michael, Karrington, thanks so much. I'm excited to be here, especially with something so near and dear to my heart.
Good. Well, thank you very much. Appreciate it.
Good. Well, Stuart, why don't we start with you? You tell us a little bit about the Bolton footprint. It might not be super familiar to everyone, but outside of the sphere, but you all are really active in a lot of ways. Can you tell us a little bit more?
Sure, Karrington. Thanks. So Bolton's an employee benefits consulting and HR services firm. We've been around for about 45 years, headquartered in Maryland. And while we have clients in the multi-employer and commercial markets, our real emphasis and where we've had a lot of passion is around the public sector employers. We have public sector employers of all shapes and sizes for both health, retirement, investment, communications, total rewards, and compensation. And we've got also a fairly new practice around talent acquisition and leadership development. So I personally manage Bolton's innovation practice, which focuses on the health centers we're going to talk about today, plus data analytics and other solutions to best manage future healthcare costs.
Look forward to hearing more.
So okay, for our listeners, generally speaking, tune into this podcast because we cover a range of politics and policy issues. During the legislative session, we tend to talk about the bills that are moving and passing, what's in the budget and all that kind of stuff as policy considerations. And some of this gets into politics as well. But sometimes it's the boots on the ground that are the topic of the moment. Counties have just gotten through passing their own budgets and casting their priorities for a year ahead. We're recording on July 1st. It's New Year's Day for people in the public sector as the first day of the new fiscal year. Whoop-de-doo. Hope everybody's nursing your morning after circumstances appropriately. But here we're talking about how we might be able to rethink the way we serve healthcare needs of our county professional staff, the folks who are the deliverers of all the public services that everyone in Maryland relies upon. And I don't know. I mean, I've been doing this a long time. The 101 level or the sort of, a legacy view here is, oh, well, of course you provide health insurance. And we know that employer provided health insurance for their employees. It can cover your hospital stay or your doctor's visits and so forth. That's the old school way. And still, for the most part, that's the backbone of ensuring their employees have healthcare coverage as a fringe benefit to make sure they and their families can be taken care of. But there's kind of a new take on healthcare delivery for a decent sized pool of employees and their families when they work in a certain area, sort of the idea of a dedicated health center. So that's what we want to talk about today. Stuart, can you kind of walk through, do a better job than I just did of the sort of, front door level of this idea of a dedicated health center?
No, sure. And you set it up very well. I think when we look at the challenges that a lot of the counties and other government entities have had, we're seeing costs really on the rise around healthcare. Access to primary care and other medical services are harder to come by these days. And unfortunately, our employees, our health plan members, are forced to choose sometimes between paying bills and getting care. And all this is leading to dissatisfaction. So what we have introduced in Maryland with a number of the counties and schools so far is a concept called advanced primary care. Advanced primary care is health centers that are dedicated to the employers that are sponsoring them. These centers offer kind of high touch, data-driven, deeply personalized care that also integrates things like mental health, chronic disease. They put pharmacies in for generic prescriptions, lab services, et cetera. So again, these centers really complement what your carrier plan has. And it's a transformative solution that comprises a lot of team-based care with smaller panel sizes.
So is this more like an urgent care model, or is it closer to having a relationship with a family doctor?
Great question. So it's really more that family physician. It's really primary care. So if you think about today's model, and this has absolutely nothing to do with the wonderful providers out there, it's the model. But most primary care physicians are fee for service, and they need to see volume. They need to see 20 to 30 patients a day. So they get about 10 to 12 minutes with you. I'm sure all of us on this have experienced this in our past. What this model does is it allows the patient to spend 30 to 45 to even 60 minutes with the physician. Yeah, exactly. And that time really allows you to dig into everything that might be affecting somebody's whole health. So it's not just coming in with a presenting issue. You can get into chronic conditions. You can get into mental health. You can get into better managing of prescriptions. So this whole idea about getting back to the days of really developing a relationship with your provider is what we're bringing through these advanced primary care centers.
That is really awesome.
Stuart, can I just add one thing? Because they're limited to a few providers to care for our employees, there's just, us in the school systems are not bombarded with a lot of health insurance plans, so they get to know our plans. So when the member presents maybe with an issue, they can really steer them to say, hey, this is what your health insurance plan offers you. So they can really maximize the benefits that the member has. So it's really a win-win for the employee. So they get the benefit of the advanced primary care, but they really get to also use their health insurance to their fullest.
Great point.
Yeah, that's interesting because it kind of feels like one of those rare cases where a better experience may actually cost less, which doesn't feel like something we talk about or have to say often in healthcare.
Exactly.
So Beverly, Queen Anne's County was basically the first to jump on this in Maryland. Can you walk us through how that happened and schools and county governments, they collaborated? Walk us through that.
Sure. So we already had a very good relationship with our school system. And back in, I guess, first quarter 2022, we are with a consortium for our health insurance, both us and the school board in the same health insurance consortium called ESMIC, which is the Eastern Shore of Maryland Educational Consortium. And the consortium had requested that Bolton present sort of this concept of these health centers or advanced primary care to see if this could be a proactive strategy to help us stabilize healthcare costs over time. Because we were concerned with the escalating cost, what was happening, and we wanted to be able to continue to provide high quality healthcare to our members at a reasonable cost. So Bolton provided this to us, and that really started our journey. And through that market analysis that they provided, they selected a preferred vendor, which ended up being Marathon Health. So we really just started from there, and we were so excited. We had been really monitoring our primary care usage with our group and saw it really declining over time, primarily because there's just limited access. And we were watching increased utilization of our urgent emergent care, which is really the more expensive way to utilize healthcare. And we were like, we just can't sustain this over time. There's got to be something different. And that's really how we got started.
So yeah, seems really innovative to me. I am kind of curious, was anyone, Beverly, that you were talking to, were they skeptical, or how did you get people on board for something like this?
Yeah, I have to say some of our employees were really skeptical at first. So we ran around to all the departments. We talked to the employees way ahead of time. But when they very first started walking in the doors, they saw how beautiful it was. They met our providers who are local providers. Frankly, we handpicked. We were part of that process. And, it just, they loved it. They loved the same day, next day availability to set appointments, which they were not accustomed to around here. Usually it's, weeks to get an appointment.
Wow.
They love the fact that they're spending time, what Stuart said about having time, 30, 45 to an hour appointment. That is true. We see that. We hear that. I can't, a day does not go by really where I don't get an email or an employee stops by my office and say, I cannot believe how wonderful this benefit is. So, just the accolades that we get. But more than that, the improvement, and I'm sure at some point we'll share this here in a little while, the improvement in the health that we're seeing is amazing.
Yeah, and Karrington, if I can add, we
Please.
saw in the data from looking at Queen Anne's County, Queen Anne's schools, for example, that over a decade, there was a steady decline in primary care utilization and a significant increase in emergency room and urgent care use.
Mm-hmm.
And a lot of that is due to we're kind of in a significant bubble right now of retirement for primary care physicians. There are more retiring that are coming in, and many are moving to concierge care, which means they take cash only, no insurance, and that typically prices many people out. And I think the important thing is we've been talking about primary care, but I want to make sure also it's really clear that this is for urgent care needs. So a member can come in for same day appointments if they have a sinus issue. We also are really getting specific in how to support, whether it's a county or a school, for example, because we're doing things like DOT exams for bus drivers or anybody that's got that kind of need within, driving within the county, first responder testing, things like that can be done that you're traditionally not going to see the ability to do with a local primary care physician.
Yes, we made the decision early on to do occupational health in our center, but that was our own decision. So you can kind of decide what services you want there based on your needs, which has been a big help for us. And I will concur with what Stuart said about the decline in primary care. That's something we've tracked for a number of years. And when we made this decision, about 33% of our population, our employees, did not have primary care, which is a huge number. When you're looking at trying to identify illnesses, diseases early on, that's where you find them, is in primary care, not so much through urgent care or emergency care. So having that primary care relationship has been important to us.
Mm.
So I find that interesting. I'm trying to think about this as a proposition for the employee, sort of as a customer experience. I mean, we're interested in better healthcare outcomes and better access, but it feels to me like some of the things you've mentioned just accumulate as a better experience for our employees who, I've got the trick knee or I've got the sinus infection and want to be seen quickly. And maybe without this advanced health center, my options would be to go to an urgent care facility where I'm a new patient. I'm a random new patient, or I wait in line for a primary care provider or a specialist. But the idea to get into this facility that's waiting for someone just like me. It's built for the educators and the county employees in Queen Anne's County. It's conveniently located, and we're exactly like the key's going to fit the keyhole here, maybe better than the more conventional open air model. Generally speaking, is that what we find from the county employees, Beverly? Do you have a finger on that this is an easier in and out and experience for them?
Yes, very much so. And we were very specific about where we put our health center. We Marathon used our data to determine where the best location, and also our knowledge of our county. And we married that together to find the best site. So it's conveniently located. And we're not big enough to have multiple sites, but we hope to maybe grow that way. But also, we structured it so that we have services there that fit them at the times that they need it. So we control the times that it's open. So we set the services in partnership with our school system to say, hey, we need some early hour appointments. We need some evening appointments. So we have the hours set that we think will be convenient to our members. So we work together to set that up for our employees so it's convenient for them.
And Michael, if I could also add to that, the members, any of the patients that come in have no out of pocket. So that is the incentive to them. They are not making visit fees or copays. Mm-hmm. So that is obviously a significant incentive. And then again, things that are really inconvenient for employees and families. So these centers are doing sports physicals, back to school physicals for children of the employees or their families. Again, very customized and tailored to the specific workforce, which has really just been a home run.
Right. They come out to our both for us in the school system, and they come out to the departments and do educational programs for helping us for wellness initiatives. They do flu clinics, they do wellness and event fairs, glucose monitoring, all types of things. So they're really integrating into our just sort of a piece of us, are part of our family.
Right.
And, that's what makes it work.
And it seems like there's a logic to this model that probably goes a level deeper even. I mean, the idea that, okay, you're already on the county health insurance and this is an offering that our county and schools pooled in on together. So you don't have to pony up $25 for an on-site copay for every visit. That's sort of baked into this service model already. So that's easier as well. If it's easier to schedule, easier to afford in the moment, like those are nice, quick benefits for the employee. But you have to think that when they get more and more care within this system and we're talking to each other, we're probably going to have an opportunity to catch more people with screenings or launch wellness initiatives that will have benefits down the road. Like, the things that you just mentioned, Beverly, it seems to me that those are smart, both short-term and long-term, that if you get people in for those sorts of things early and we start to detect, okay, you're someone who could be on a cycle, we'll make it really easy for you to get this follow-up. This seems like that's a best practice in the business, that the simple like buyer seller in the floating open marketplace may not be as coordinated as this. It just seems smart at that level as well.
Right. So let me just share with you. So we of the patients we've seen, at least 52%, so a little over half, have at least one chronic condition. But some good news on that, 74% of all patients have at least one biometric. So like your A1C, your hypertension, that are reading into the moderate to high category. Of that total, over the last 22 months, based on multiple biometric readings, 73% of the patients are making health improvements. So we're seeing a better outcome in those biometric data measures. So we're starting to see positive returns because they can get easier access. They're not ponying up, $25, $10, whatever it might be for a lab test every time. They don't have to go to their doctor that's in one location and their lab in another location, all in the same place. So and they have time to spend with their doctor to figure out what issues are there. So we are starting to see, some positive returns in that area.
Yeah, that's great. It's no cost to them. It's flexible. There's preventative, and they're getting longer time with those physicians. It's really great. So, Stuart, Queen Anne's County was kind of the first in on this. We got Mako to sign on and basically endorse this whole thing. So, is this idea now catching on? Who else is doing this?
Yep, great. So, besides the wonderful support by Mako, the Maryland Association of Boards of Education has also endorsed this health center strategy. And because benefits are so critical to recruiting and retention, the health centers are really a true differentiator, and I believe that's being seen by many across the state. So besides Queen Anne's County and schools, the others include Frederick County, Harford County, St. Mary's County and schools, Wycomico County and schools, Talbot County schools, and Washington County schools. And there are 3 other counties in various stages of due diligence. So it's really catching on. And the last thing I'll just say about it is what's been great about all the counties and schools working together is there is reciprocity among all of the various employers here, the counties and schools. So if I work for Queen Anne's County government and I'm driving to the beach and I have a quick need, I can actually stop by the Wycomico Health Center and use it. Yes, and use it for basically urgent care needs. It's not where I'm going to have my primary care, but I can stop and use it. And that's just a really nice benefit across the state.
That's another really amazing benefit. So I'm curious then, so do you think we're at the tipping point where this becomes more common, or are there still any barriers that counties are wrestling with here?
There are barriers. I think the barrier, one of them is certainly is the initial cost. We've been very, very fortunate between some grants and some state funding that has helped kind of accelerate some of the build out costs and move these along. I think also there is a size restriction. Certainly, a small county or school district, kind of under 500 lives or so is going to have a hard time justifying this. But I think outside of that, the nice thing in the future with this footprint that's being established across the state is others can join with permission from, let's say, Queen Anne's County government. So if Chesapeake College, for example, decided they wanted to join, then that's something that can easily be facilitated as long as all parties agree to it and it makes sense and there's capacity. So we see this growing as we expand over time.
Right. So it's adaptable too. It can grow and change whatever the local needs are.
That's correct.
Yeah, that's great. Beverly, so you told us about some statistics. Any other stats you want to share, or any success stories that you want to share with our listeners?
Sure. So we actually opened our health center in July 31st, 2023. So we're coming up on our 2-year anniversary. Time goes by, can't believe it. So our initial goal to sort of break even was to meet 35% utilization at the end of year 2. So May of this year, we actually reached 37% utilization. So we actually exceeded our goal, which was very exciting. But that just tells you how enthusiastic our employees are. And that is a combination of employees, spouse, children, and retirees. But our employees actually, just if we look at their utilization alone, is 56%. So our employees have really embraced this concept. So that's really exciting. I will say we did talk a little bit about the urgent care. If you look at this model as a sort of same day, next day appointment model, we estimate 128 urgent care or ER visits were avoided with a savings of $51,000 to the county. And I will say that we do monitor our urgent care visits with our health insurance program, and we've seen this year a 95% reduction in our urgent care visits. So we're seeing that on both sides when we look at that.
Right. There's an ease on some of those already strained resources.
Correct.
That seems to underscore the idea that you may need to make an investment up front to repurpose some existing space or to buy or lease or whatever, some space for the facility itself. But then on the back end, you start to see a change in usage and probably a reduction of costs, whether it's costs that go through your insurance policy, or if you're a large enough jurisdiction to self-insure, you're just directly seeing a drop in out-of-pocket costs to cover your employees. So it's a win. There may be a period of time it takes for it to pay for itself, but it probably does, right?
Correct. Yeah.
Yeah. I was going to say, Michael, that's absolutely correct. And that's one of the reasons why this model has really taken off across the country, and why, from Bolton's perspective, we've been behind it in Maryland, because it will, if done correctly, meaning you got to get people there, you've got to have a great staff, the customer service is key. It will start to control your healthcare spend in the future. I think the wonderful thing across the state so far with all the health centers that I mentioned earlier is the average net promoter score has been in the mid-90s. That is really unheard of in most industries, let alone healthcare. So the bottom line is the employees and their families love it, and that keeps them coming back.
That's a good place to be. Yeah.
Yeah, we talked about the time frame that the providers spend with the patients, and they're really working to the full capacity of being a primary care physician and utilizing a lot of the resources that Marathon offers. And we looked at that, and the county had about 260 some patients that, because of that, did not need referrals to specialists. Not that they don't refer to specialists when they need them, but we predict that is an estimated savings of $152,000 for us, just because they're using the full capacity of being a primary care physician and having that extra time with the patients. So there's a lot of savings that we gain from this model.
Well, I mean, it seems like we're touching a lot of bases here. Like, as far as outcomes from an effort like this, the idea that our employees and our valued staff are getting potentially better and quicker care, that their customer experience seems to be better and simpler for them. We have an opportunity to bring some costs in-house and control costs in a way you can't when we're just out into the overall network. It just seems like in the aggregate, this is a win-win-win. we don't run into those all that often in the public sphere, right? Sometimes we're debating about winners and losers or zero-sum games and so forth. This feels like an opportunity where the employees are better off, the employers are better off, and we end up with outcomes that can be better for the people we're trying to take care of. And I like every bit of that.
Yeah, especially in healthcare.
Exactly.
Yeah, you're absolutely right. And I have to say, I've been in human resources now for well over 35 years and have implemented a lot of benefit programs, and this by far exceeds them all. I mean, the impact that we have to employees, to their families, the amount of positive feedback, it's just amazing. And to be honest, I can't wait to see what we do next with our health center. I'm really excited.
Yeah, that's great. And again, really just goes back to recruitment and retention too. There are a lot of ways that local governments, it's hard to compete with the private sector. And this is just a great approach to do both that. And then again, just really take care of those employees. So love to hear that. Anything else, Beverly or Stuart, that you want to add for our listeners, or anything that we didn't get to?
Karrington, you mentioned something. I won't get into the names, but there is one health center that's going to be opening soon that is next to another county that has a health center. And one of the many reasons they decided to move forward was they actually lost some employees to the neighboring county. And in their exit interviews, were told that they were leaving because they could get free health care at the next county over.
Wow.
So very interesting. And that was an unintended consequence, but it does show that really how much people value this, because I don't think we all really realize how daily it is such a struggle to get good care. Mm-hmm. And the last point I'll make, because we didn't really talk about it enough, is all of these centers have access to mental health support, whether virtually through the provider, or actually a number of the centers across Maryland have a full-time in-person mental health provider. That is just an absolute home run in today's environment, to be able to get, not only your primary care needs, but mental health needs all serviced within one location.
Really smart way to take advantage of the access that being on site and being in everybody's plans really offers. Beverly and Stuart, thanks very much for carving out a little bit of time to talk to us and talk to our listeners. These are folks who are interested in public policy, and on-the-ground service delivery is sometimes the unsung hero of policy chat. But getting stuff done for the people who make the difference for everybody across Maryland, this is counties at our best. Really happy to have you both on and help spotlight this innovation. Thanks so much for joining us.
Thank you.
Thank you very much.
Thank you.
Thanks, listeners. And this wraps up one more episode of the Conduit Street Podcast. If you liked this episode, and I know you did, go ahead and smash that 5-star review and tell friends where they can find us. That's the best way for us to get more folks in on the action. With that, on behalf of my colleague, Karrington Anderson, our guests, Beverly and Stuart, thanks so much for joining us this week, and we will talk to you soon.